What's up, guys? Welcome back to my channel. My name is Masud, and in today's video I wanted to talk to you guys about what to expect when you actually go on your sort of elderly care placement, especially as a student. So what to expect. So the first things first, when you actually get onto the placement, you sort of notice how slow everything is. I especially noticed this because in my second year I had a sort of back-to-back structure of clinical placements. I had like one placement, 5-week placement straight after the other. It was an MSK outpatients placement, and then I had elderly care afterwards there, straight after. And honestly, I was like, whoa, like it was just such a drastic change in pace. Because if you're a physio student, as you can sort of imagine, MSK outpatients is like bang, 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 everything quick, right here. And then going on to my elderly placement, we didn't start the day until like 11 a.m. So that was like very, very like, it's something that came as a shock. I was like, wow, okay. I might have to slow down a little bit here. Yeah, so the pace of everything is really, really slow. I guess people do say that elderly is sort of the easiest placement to get, because you're not really, you do have the input into the patient's rehab, but it's not, you don't have to, I don't know. Qualified physios and a community physio might argue with me about this, but I don't think you have to know as much as you do in comparison to an MSK outpatients placement, a neuro placement, or a respiratory placement. I don't think you'd have to know as much. Generally, the things that sort of come up in elderly are sort of more older people who've had a fall and fractured a bone, or they've have, so things to look out for is or study, or you should know is the people there are going to have sort of comorbidities before coming in. So they may have sort of neurological problems such as Parkinson's, or have had a stroke of some kind, or have musculoskeletal conditions, for example, degeneration of their knees, hips, joints in their body. They might have some spondylosis in their spine, so they're going to be slower moving about and getting out and about. So whenever you do approach these sort of patients, just make sure you take that into consideration, and your communication is going to be the main sort of skill that you're going to need to master in this sort of setting. So how are you going to sort of adapt your communication to fit the patient's needs? I would say use sort of photo cards, use short, simple sentences or cues. For example, if you're getting a patient to do a bridge, how are you going to sort of get them to do that? One way I like to just say it is, bring your heel, so push through your heels, squeeze your bottom, and lift your pelvis up, and things like that. Just short, sort of simple cues to make it simple for the patient to understand is really, really important. And another thing is, just make sure to have respect for everyone, because even though they are a patient, at one time they were your age, and at one time they were sort of playing sport, running about, living life really, and now and then this sort of condition, and you're sort of coming in there and telling them to lift their lift the leg up or lift the arm up or whatever. It's not very creative. So just try and make everything that you do fun and engaging, because that's when you'll see the most sort of success in elderly care. I wanted to sort of say, yeah, the main sort of things you're going to be doing in elderly care is looking after, sort of mobilizing patients, getting them up from their bed, or getting them up from their chair and having a walk with them. And you're going to be working with the MDT team, the nurses, the OTs, the social services sort of staff, to get the patient home as soon as possible. So discharging them, you might go on a visit with the OT to someone's house. You might go with the community physio to see someone at their house, and generally work on sort of improving different aspects of the person's physical function. Yeah, so you're going to be doing a lot of talking and walking. So walking and talking, that's literally that's what you're going to be doing, to be honest with you. And you're going to be sort of making goals for patients when you do assessments. It's really not any different to what you would normally do. So looking at sort of, you do a neurological assessment, you have to know that, a neurological assessment, a musculoskeletal assessment, and general exercises which patients can do that are easy to help them exercise. But yeah, so I hope that helps. I've probably missed a whole bunch of things, but I always try and keep my videos short, just to keep you guys interested and awake. I don't want to put you to sleep. So if you do need any other sort of information, or you want to ask me anything else, just put a message for me in the comment section, or send me a message on social media. And if it needs a sort of further evaluation or anything, I'll just make another video, because I have no problem doing that. But other than that, I just want to say thank you for watching this video, and yeah, take care.